Can't find your cervix? Perplexed by your cervix? Haven't even heard of a cervix? You're in the right place. In this video, I'll answer questions about how to find your cervix, what is it gonna feel like, how it changes throughout your cycle, and how you can track it to better understand your fertility. Hi, I'm Mary-Aline. I'm your certified fertility awareness educator, and on this channel, I talk about natural ways for people to manage their fertility and their health. So let's get started. What and where is your cervix? So the cervix is actually the lower part of the uterus. It connects the uterus to the vaginal canal, and it actually extends into the top portion of the vaginal canal. So if this was my uterus and this is the cervix here, and this is my vaginal canal, it sort of sits in here. People who are designated female at birth have a cervix, and some intersex people also have a cervix. The cervix plays many important roles in our body, including for fertility, pregnancy, vaginal delivery, menstruation, and also protection. So it keeps bacteria from getting into our body. The cervix can tell you some very magical things about your body and is connected to your hormones and therefore your cycle. So because it's impacted by the hormone estrogen and progesterone, you will notice changes in your cycle as you move throughout the different phases. And it's really important for fertility. So the cervix actually has these things called crypts, which are essentially like little tunnels, and it secretes different fluids that support with fertility. And so you might have heard of cervical fluid or luteal fluid. It's the same as luteal mucus and cervical mucus. And so this actually works to support our fertility. So the cervix is really an amazing part of our body, and it really doesn't get enough love and enough attention. And most of us have only experienced our cervix being touched through penetration or during a pap smear. And so including cervix checks into your daily routine is a really beautiful way to connect to this part of yourself that is the gatekeeper and is the protector and is the guardian of our inner womb space, our uterus. And so if you don't want to get super woo-woo or energetic with me, that's totally fine. You'll still get benefit from this video, and I'll talk about very practical ways to connect and to check and find your cervix. Join me as we delve a little bit deeper into how to find your cervix. Make sure that you have clean hands because the cervix is an entry into our uterus, so make sure you have clean hands. Sometimes that means washing your hands before you go to the bathroom and then washing them afterwards. And also make sure that you have fully eliminated. A full bladder or full rectum can push on the uterus and cause the cervix to be in a different place. So if you're having a hard time finding your cervix, make sure that you've gone to the bathroom before you're doing this check. So there are 3 different positions that I typically recommend when I'm teaching people how to find their cervix. First one just being when you're sitting on the toilet, you might be able to feel your cervix from that position. If you can't do it in that position, then the other position I recommend is a deep squat. And so when you're in that deep squat, you're gonna wanna make sure that your heels aren't planted flat. You're gonna wanna have your heels up. Planted flat might be even a little bit hard for some people, so you do want your heels up. And then what you might do is tilt your pelvis back just slightly, tucking your tailbone under. The last position that you might try is what I call pirate's pose, or it's just one leg up on the side of the tub. And what you want to do is you want to insert your longest finger, usually it's the middle finger, and what you'll feel is like the tissues of the vaginal canal they might feel supple, they might feel textured, they might feel ridged, but there's no firmness to the vaginal walls. And then you're going to make your way all the way up to the very top of the vaginal canal, and what you're going to find is something that feels sort of like the tip of your nose. It feels firm. The reason why people have a hard time finding their cervix is because they either may be at a certain time of their cycle that makes it more challenging to find their cervix, or they might have a different anatomy so that depending upon their uterine tilt or the way that their uterus is positioned in their abdomen, it might make it a little bit more challenging to find your cervix. In that case, I recommend getting into that deep squat and bearing down, almost like you're trying to have a bowel movement, and seeing if that helps, that pressure helps push your cervix deeper into your vaginal canal, so you might be able to find it that way. Typically, I like checking my cervix at least once a day. Here are my pro tips for checking your cervix. Go slow, get permission from your body, and send some love. You do not need to push through the pain, to push through the sensitivity. If your body says no, if your cervix says no, please listen. Some of us are more sensitive to touch, especially at certain times of the cycle. Your body gives you any of these cues to slow down. Please listen. Your cervix has a story to tell. These stories may include pleasure, they may include pain, trauma, childbirth, miscarriage, pregnancy release. There's a lot of emotions that can be stored in this part of our body. So please go slow. And then when you do find your cervix, please send this part of your body some love, because our cervix does not get enough of that. If you're getting value from this video, please let me know by hitting the like button. If you're on the pill or other forms of hormonal birth control, you may not notice any changes in your cervix throughout your cycle, because the synthetic hormones cause the natural cycle to be interrupted. There are a few things that I want you to tune into when you are performing your cervix checks. That being height, texture, the opening of the os, the opening of the uterus, and also how the tissues of the vaginal canal feel. When you are tuning into the height of your cervix, ask yourself the following question. Is your cervix high, medium, or low in the vaginal canal? Does it take a full finger to feel your cervix? When you're tuning into the os, or the opening, this is like the dimple or the little indent of your cervix. This is actually the channel that leads to the uterus. This is the channel that the sperm swim up in order to get into the uterus and to connect with the egg. Ask yourself if that opening feels really open or firmly shut. When you're observing texture, I want you to ask yourself, does your cervix feel soft, maybe like your lips or like your cheeks? Or does it feel firm like the tip of your nose, or maybe somewhere in between? Another thing you might notice is that the alignment of your cervix may change throughout your cycle. So when you are in a fertile time of your cycle, when estrogen is really high in the body, you might notice that the cervix actually becomes a little bit more straightened or aligned in your vaginal canal. Versus when you're at an infertile time of your cycle, you might notice that your cervix is more tipped to either the left or the right, or maybe the front or the back. So if your cervix is tipped one direction or the other, when you're inserting your finger, you might feel the side of the cervix rather than the center of the cervix. This can give you a lot of information about the position of your uterus. And don't worry, it's okay if you're like, I don't even know what I'm feeling. or you're like, oh, okay, I can really understand the height of my cervix, but like I have no idea about the opening. I have no idea about the texture. The more that you develop a relationship, the more consistently you check your cervix, the more you'll start to sort of decipher these nuances and these like subtle changes. So When I first started doing this, I could only pay attention to one characteristic at a time, and I just focused on that until I felt really confident in understanding that characteristic, and then I sort of continued to expand from there. After your period might be a great time for you to start checking your cervix to get to know this part of your body a little bit more and see how it changes as your fertility is building and throughout that fertile time of your cycle. Have you found your cervix yet? Let me know in the comments below. Checking your cervix can be extremely helpful for people that are not wanting to get pregnant and also for people that are wanting to get pregnant. It's a secondary fertility sign along with your primary signs of tracking your basal body temperature and your cervical fluid. So if you're using this method for birth control, you'll absolutely want to be tracking those two other biomarkers. Your cervix can help you identify when you're nearing ovulation. What you'll notice is that when you're in a fertile time of your cycle, your cervix will feel high, soft, and open. When you're in an infertile time of your cycle, your cervix will feel low in the vaginal canal, firm and closed. And you'll notice that these changes happen on a cyclical level. Some obstacles to cervix checks is that for a lot of us, it's confusing at first. Don't worry, you're not alone. This is brand new feelings, brand new sensations, right? And we're trying to understand them. Another thing is that some people are very, very sensitive. Their cervix is very sensitive to touch and it can just feel really unpleasant. So listen to yourself. You do not need to push past the pain or the discomfort. This is a practice for you, not for anybody else. And what I would like to invite you is if you would like to see your cervix at your next pelvic exam or pap smear, ask your medical practitioner if they can offer you either a mirror or could offer to use your phone to take a picture of your cervix after or before they do the pap smear or the exam. Talk with your medical practitioner before the exam occurs, and what they would do is they would insert the speculum, and then you could either use a hand mirror to view your cervix that way. They could hold up the mirror to help you view your cervix, or they could take a picture on your phone of your cervix. Are you using cervix checks as part of your cycle tracking or your fertility awareness method? I would love to know, and let me know if you have any other questions about your cervix. If you are charting your cycle for non-hormonal birth control or to help you get pregnant or to just monitor your health, I made this awesome video all about basal body temperature. And so feel free to watch that next. And as always, I hope your temp shifts stay clear and your cervical fluid juicy. Thank you so much